Let's talk about the aftercare following otoplasty or cosmetic ear pinning. The things that I would like to talk to you about today are the things you need to know. The night of the procedure, you're going to have a large, almost like a Princess Leia, for you young people, you don't know what that is, but Princess Leia was from Star Wars. A big, looks like Danishes on your head, the big white wrap around your ears. That's going to come off the next day when I see you in the office. I'll see you on the first day. I'll take that off. There'll be tiny little drains. I'll slip out. I promise you won't feel the drains come out. The sutures behind your ears are dissolvable for the most part. I really rarely use sutures that are not dissolvable. And then sometimes by week 2, second week, I'll take those sutures out. For what you're expecting for the recovery time, the first night, the night of the procedure, your ears can feel quite sore. That soreness really, in about 95% of the time, is gone by the next day. So if you wake up in the middle of the night feeling soreness in your ears, it's normal. I do use a long-acting anesthetic in that area, but I encourage you, probably the night of the procedure, go ahead and take a narcotic, if we'll prescribe that for you, just to help you through that night. But the next day, really that soreness is dissipated in a majority of patients. If you're having a lot of discomfort or something's not right, please just give me a call. I'll be happy to speak with you and figure out what's going on, especially if soreness is more on one side. That would be something I would like to know about the night of the procedure. But that's normal to have soreness that night. Then you're going to wear a headband that I've asked you to purchase beforehand, 24 hours a day for 7 days on that area, and then you're going to take that headband off after your 7th day. And again, I'm going to see you at day 1, day 7. I may even see you at day 14. Sometimes I even see you a couple times more if I'm seeing more swelling than I like to see. And that's normal. Sometimes after your 2nd day there's more swelling, like most of my procedures, and that settles back. But most of my patients after otoplasty don't get a tremendous amount of swelling. They get some, but not a dramatic amount. I'm very good at otoplasty. It doesn't take me a long time to do the procedure, so you get proportionally less swelling, but you could get swelling. And the headband then you're going to wear at night for a full 6 weeks. In other words, during the day you're not going to wear it, but at night you're going to wear it for a full 6 weeks. After your 6 weeks, you really can take that off. I have a few patients that are very concerned they're going to hurt their ears, so they wear it for the whole year. I see them back a year later and they're still wearing their headband. I really think after the first 6 weeks you're okay to go and take off the headband. Be careful with sports. I don't have a definitive time for you not to be in contact sports. I would probably say even 3 months to 6 months would be a conservative estimate. In terms of just lifting weights and going back to work out, that I don't mind so much, even after, I would say, 10 days or so. But just be careful in terms of people pushing and pulling on those ears. Very, very important for you to understand that. Hopefully that was helpful for you to think about after an otoplasty procedure. I would encourage you to watch us a few times the week following the otoplasty so it can reinforce some of the ideas I've presented.